The coronavirus spread across the globe, affecting everyone, including the developmental disability community. Here's a news clip from CBC News about an outbreak in one of the homes in Ontario.
Reportedly, staff walked out when they found out that there were a number of positive cases in that home. Laura Meffin made the call to pull her daughter Emily out of the residence earlier this week due to an outbreak. Participation House is a facility for adults with disabilities. However, Emily has developed a fever and she may in fact be sick. These are some of the tweets that led us to this story. Laura is now concerned she won't be able to provide the care her daughter needs for long.
The pandemic has been particularly rough for people with developmental disabilities. The news clip shows two problems that the DD community is facing: the high turnover of staff due to the virus outbreaks in homes or in the community, and the loss of daily care and services for some individuals with developmental disabilities. We are First Choice Family Services, and stay to the end of the video as we answer one of the biggest concerns seen on the internet about developmental disabilities. Developmental disabilities and COVID-19. It's been more than a year since the coronavirus spread across the globe. We know that anyone can become infected, but healthcare professionals have identified groups who are at higher risk. The question is, are people with developmental disabilities automatically at higher risk for becoming infected? According to the Centers for Disease Control and Prevention, CDC, unless individuals with developmental disabilities have serious underlying medical conditions, they are not naturally at higher risk for becoming infected. COVID-19 prevention for people with developmental disabilities. Another concern pointed out by the CDC is that some people with developmental disabilities may have difficulties accessing information, understanding or practicing preventative measures, and communicating symptoms of illness. Which brings us to a popular word: prevention. The best way to prevent getting infected is to avoid being exposed to the virus. So, here are 6 easy steps for prevention from the CDC. Get vaccinated. If it is available and safe as recommended by health experts, get a vaccination. Wear a mask that covers your nose and mouth. Doing this does not only protect you, but others as well. Observe social distancing. Stay at least 6 feet apart from those who don't live with you to avoid close contact with possible carriers. Avoid crowded and poorly ventilated spaces. These places put you at higher risk of contracting the virus. Observe proper hygiene. Wash your hands often with soap and water, and always clean and sanitize. Monitor your health. Check for any symptoms, and if you do notice symptoms and they continue, seek medical help. In conclusion, people with developmental disabilities are not automatically at higher risk for COVID-19 unless they have underlying medical conditions. However, they are a vulnerable health population in the sense that they may not receive adequate attention within public health interventions. It's important that we remember to diligently follow guidelines in preventing the spread of COVID-19. Not only does this keep us safe, it keeps everyone around us safe, including people with developmental disabilities. Thanks for watching. Remember, First Choice Family Services is your information resource for the DSP industry. Like, subscribe, and hit the bell notification to stay connected.